Hello. My mask always gets tangled up in my glasses. I don't know about you, besides fogging them up, but it's a price we have to pay. My name is James Mallory. I'm the chairman of the Iredell County Board of Commissioners, and on behalf of the entire Board of Commissioners, I would like to present to you a brief update on where we are in terms of our COVID statistics on this Friday, August the 21st. Today, we have 2,266 confirmed cases, and that's before the Friday afternoon release of numbers. We have a total of 12 that are currently in the hospital, and we have a total of 23 deaths cumulatively to date. In terms of the county breakout between the three areas of the county, the northern area of the county has 478 confirmed cases to date, which represents 21% of the county's cases, which is exactly equal to their 21% of the population north of Interstate 40. The central portion of the county has a total of 921 cases to date, which represents about 41% of the total county cases, but that's more than their percentage population, which is about 34%. And in the southern end of the county, which is the bottom lowest four zip codes in the southern end, there are 867 cumulative confirmed cases, which represents about 38% of the county's cases against 45% of the population of the county. There's a positivity rate of about 6 to 7%, which means that, generally speaking, about 6 to 7 people per 100 folks in the county are going to have an active case of COVID-19. The goal is to get that down to around 5%. That's the number that it's felt is recommended, at least by the CDC, to be opening schools fully. The hospitalization rate, which is probably the bottom line number that we're looking at, because if you'll recall, when the COVID-19 pandemic started to present itself, the concern was keeping our healthcare organizations, our hospitals in particular, from being overwhelmed by cases, as we were seeing in New York City and other locations. And as a result, today I'm happy to report that the number of hospitalizations has decreased from the high of around 29 to 30 in the middle part of July to around 12 today. And if you'll look at the graph on the video, you'll see that over time our rate has pretty well held steady at around 6 or a little less than 6 until mid-June, when it bumped up to around 13. And that we're seeing really there is a 2-week lag between some major event and a spike in both cases and hospitalization rates. The major event then was a Memorial Day holiday, followed very quickly by a transition from phase 1 to phase 2 and a greater opening of our economy, and therefore more social interactions. After that event, the July 4th holiday weekend seemed to be a precipitating event, because shortly thereafter our rates trended up both in terms of cases and hospitalizations rather significantly, and that was alarming. And I mentioned to you at the time that we were experiencing that we needed to buckle down on wearing masks and being socially distant, or if we did not, we would be on track to triple or quadruple the number of cases that we had in early July. Well, the results for July were baked in for the first 2 weeks because everything is sort of on a 2-week lag from the time people get infected to the time they decide to get tested to the time they get test results back, which could be 4 to 5 days. It's about 2 weeks before it shows up in our data. So the numbers spiked, but came down towards the end of July. So we were on a downward trend. And if we maintain this downward trend, we will be in a good position. Our hospitalization rate numbers were as high as 29, and then they have come down to as low as about 13 or 12 on average. So what's coming around the bend, of course, is the result of the next large event that we've experienced, which is the reopening of schools. The jury's out on that. I can tell you that our schools have a very good plan. About 75% of the students that are working under Plan B of the Iredell Statesville schools are in school, and 25% are utilizing the remote instructional option. Mooresville Graded School District is 100% remote instructional option, and Iredell Statesville Schools has 2 high schools, Lake Norman and South Iredell, that are also on the remote instructional option. There are isolated cases that have been determined, and most of those cases did not result in significant closings or anything like that because there was limited contact based on the strict enforcement of social distancing and masking. But the jury's out. It's only been a week since kids have been back to school. Most of the positive tests have been the results of staff or students who have been exposed at events that were not at school. They brought that or participated in some event and were exposed and then were determined to be positive when they were at school. So our schools are doing a good job of executing a plan, but any plan is only as strong as the weakest link in terms of the execution of that plan. So I encourage everyone to very strictly follow the guidelines because there's a great deal of benefit in instructional one-on-one, face-to-face instruction. But if all it takes is a few cases that are going to have significant spread or contact that will cause our schools to have to reassess their position, and we don't want to put them in that position. In terms of comparing Iredell County with some of our surrounding counties and regional counties around Mecklenburg, I think you can get a sense that we have been more successful than many of the larger counties that are in the same category as we are. If you take a look at the chart that you should be able to look at on the screen, Alexander, Davie, and Lincoln County have lower per capita rates than we do, but not by much. Lincoln County is at 117 and Iredell County is at 119. Cabarrus County, which is probably one of the counties that is the most significantly similar county in the metro area to us, has 138 cases per 10,000. Wilkes County to our north is 139. Catawba to our west has 151. Yadkin to our northeast has 158. Rowan County to our east has 175. And of course, the McDaddy, Mecklenburg, has 218. So I'm very pleased with the response of the citizens of Iredell County to take this seriously and to practice the 3 W's. At this point, I think probably those that have taken it seriously and those that are not taking it seriously have probably baked into their normal routine those activities. So if we continue, those who are taking it seriously continue to do so, then I am hopeful that we will be able to continue to limit the spread to a manageable number, keep our hospitals from being overwhelmed, save money in terms of hospitalizations, because as you know, it costs a pretty penny to be in the hospital for a day, and to be able to then be in a good position to take advantage of a vaccine, which hope by the end of the year or the early part of 2021 will be broadly available. At this time, I'd like to share a couple other items. It's almost flu season. We don't know what the flu is going to look like this year. We never do. The flu vaccine is an evolving proposition in terms of its composition from year to year, and it's really based on the prevalence of flu in the southern hemisphere, which is obviously in their winter months, rolling into their spring months. And so whatever seems to be prevalent in the southern hemisphere, they typically have used that as a guideline for developing flu vaccines in the northern hemisphere. Those flu vaccines have been prepared. They're stocked. There are over 200 million doses available nationwide. And the time to get those vaccines, they've just now been distributed or coming online at the various drugstores and at your physician's offices and at the health department. So the vaccines are good for about 6 months. The flu season runs from sometime September, October through March and April. So it's recommended that you, without fail, get your vaccine before the end of October. And certainly if you're in a higher risk category, you may want to get it a little earlier than that. There is a 2 to 3 week delay in terms of its full effectiveness. What we don't want is to have people with both the flu and COVID. We just don't know what that might look like, and it would probably be fairly serious in terms of their medical condition. Finally, I want to mention the census. The census has heretofore been conducted on a self-response mode, either by telephone or by a website. And our response rate to this point has been 65% of the county being counted, with, depending on census tracts, a high of 80% or a low of 45%. It is vitally important for Iredell County and indeed North Carolina for as many people to be counted in the census as possible, because federal funding, apportionment of political districts to reflect our population and an equitable distribution of representation in Congress and the legislature are all dependent on that census. And they will be completing this self-reporting the end of September. At that point, there may be census teams going out, but because of COVID, obviously, I think that's going to be a challenging process. So please, if you haven't already responded to your census inquiries, go online, find out about how you respond, and get counted, because you count. Finally, have a safe and relaxing Labor Day holiday coming up. Practice the 3 W's, and we'll see you soon again. God bless.